Hi, this is Anissa Palacios, and today we'll be learning about the effects virtual reality can have on our perception of pain. Have you ever experienced anxiety from going to the dentist or worried about a surgery or procedure, how painful that might be? We can learn so much about pain just by looking at the receptors. Let's get familiar with the context. We can think our top-down feedback from our brain, which is significant for reducing sensitivity to pain by modifying the intensity of pain signals. This happens when the body releases endorphins in order to have an inhibitory effect on pain-related neural signals in the central nervous system. Now let's get into the studies. Imagine the worst pain you've ever felt. Now imagine having to go through that pain every single day when your wounds are getting cleaned by a nurse. For many burn patients, this is what they have to endure. Even with strong pain medicine, dressing changes can feel tough. Nurses often describe these moments as the most difficult parts of their job because the pain is so severe. But what if for a moment you could leave the hospital room and enter a new reality? So in this study, 5 burn patients agreed to try 3 kinds of dressing changes. One where they had active VR, where they could move and interact with the virtual world. Then passive VR, where they have a calming scene where they don't have to move or react to the world. Or no virtual reality condition with no distraction during the dressing change. So the patients were interviewed, and now patients describe feeling less pain because their attention was somewhere else. Even nurses noticed that patients seemed more relaxed, moved less, and handled the procedure better. The study showed that VR, especially active VR, can reduce perceived pain and anxiety for burn patients. So it's not necessarily a replacement for pain medicine, but it's a good tool to utilize. A tool that can help someone step out of their pain, even if it's only for a few minutes. Now with the second study, imagine you're 5 years old. You're tiny, sitting in a big chair with bright lights shining in your face and all the tools buzzing around you from the dentist. For many kids, even a dental procedure can feel scary. And what is a simple way to help them feel calmer and less anxiety? Well, this is where virtual reality comes in. So they studied 120 kids ages 5 to 8 who needed short but slightly invasive dental treatments like fillings. They split them into 2 groups, no VR and a VR group with 60 in each condition. And they measured anxiety, they measured pain ratings, and also they examined their salivary cortisol, which is a stress hormone in spit. And the results showed that they reported less pain, less anxiety, and we saw they had lower cortisol levels. In the next study, they examined, is there anything not medicine, something else that can help patients feel calmer and more comfortable before their surgery and after their surgery? The researchers utilized 2 tools for this. They utilized hypnosis and virtual reality. And oddly enough, they also combined the 2 into a virtual reality hypnosis group. So they recruited 100 patients who were about to undergo cardiac surgery. And each patient was randomly placed in 1 or 4 groups. And it was a control group with no special technique, a hypnosis group, a VR group, and the 4th group is a virtual reality hypnosis group that combines the 2. And each patient received 2 sessions of each, 1 before surgery and 1 after surgery. And before surgery, usually anxiety is high, and after surgery, pain and fatigue are high. So research measured anxiety, fatigue, pain, absorption, which is how deeply focused they became, and disassociation, feeling separated from the stressful moment. Their findings were significant. They also did a similar VR study with chronic low back pain, where they found VR can change the way pain is processed. So it teaches us chronic pain doesn't only live in the body, it is signaling patterns, expectations, and perceptions. But VR gives us a way to gently interrupt those patterns, to offer a brain a new direction, and to help people rediscover what it feels like to live without constant, relentless pain. In the next study, they also examined port needle insertions patients because it is often painful. So they utilized the concept of VR, and with the sample of children, in their sample they had a VR group and a control group, and they utilized the Wong-Baker's face pain rating scale, and they utilized it before and after the insertion of the needle, and they found out that there was reduced pain scores for the VR group. In this study, I found it interesting because it utilizes virtual characters, and a virtual character provides social support during the VR, virtual reality. So they examined healthy patients that received heat pain stimulation while undergoing the conditions in immersive VR. They found out that virtual characters providing social support can reduce the pain perception. And in our last study, they examined cancer children that undergo multiple cannulations during hospitalization, and these are often met with fear and pain. So they examined 80 cancer children with into an intervention group and a control group for the virtual reality, and they found that pain perception was found to be significantly lower in the virtual reality group. So in the studies provided, they all showed statistically significant results for pain perception being reduced by virtual reality.